you for joining us for our Katz conversation, where we take a deeper dive into getting to know our women's health experts on a personal level. I'm Sharon Zarabi Fern, and today I have the privilege of sitting with Dr. Lily Zimmerman, reproductive endocrinologist and infertility specialist. Dr. Zimmerman, thank you so much for joining us today.
Of course. Thanks for having me.
Yeah, we're diving into a field that touches, honestly, like the deepest hopes and dreams of so many women. And you really help bring that dream to life. So, talk about purpose. To kick us off, tell us a little bit about like what was that initial pull that led you into the world of women's health?
So I grew up my whole life planning to be actually a dermatologist. Since kindergarten, when they asked, what do you want to be? I wrote dermatologist, spelled a little incorrectly, because I had some family members, who were in the field. And then I did kind of pursue my dreams in college, and I ended up going pre-med and then went to medical school. And in medical school, actually, it was right before medical school, I think, that started women's health because I actually spent a gap year between college and medical school working on a research project, and I worked with women who had breast cancer. And so I think that actually, when I think back about women's health, I think that actually started kind of the pull in the direction, and I didn't even realize it, but I love that year. And then when I went to medical school, I actually put OBGYN as one of my last rotations. I thought there is no way I'm going to end up in OBGYN. And I had everything lined up for a research project in dermatology, which was my plan. And then I did my OB rotation. And I have to tell you, I was exhausted. I was waking up at 4 a.m. I was at Columbia, New York City, and I was taking the subway up. And I was completely exhausted, and I had never been happier. So I realized that this was kind of what kind of drove me in medicine, and I had to pivot. And luckily, my year in medical school, they had kind of rearranged the curriculum, and everything was 6 months earlier. We were the first year where they had this new curriculum, so I still had time to kind of make that pivot and, apply for residency, and get into OB. And I said, you know what? OBGYN is such a huge field. And every rotation that I did within it, as I rotated in medical school, I was more obsessed with. And I
Yeah.
just found that working with women and kind of this population was really fulfilling.
Yeah, I mean, you're a miracle worker. We speak about infertility, and so many women are starting their lives a little bit, family planning a little bit later, and
Yeah.
there is a little bit of a struggle. So, I mean, can you tell us what, what you do brings so much purpose and fulfillment. So, can you share, what a day is like in your shoes, with your patient stories and maybe highlight?
Yeah, I mean, the truth is that every day is different because I see so many different patients at different points in their lives. So a day may include, meeting with patients who are coming to me to freeze eggs, maybe what we call electively, which is for social reasons, but really sometimes it's not truly elective, it's because their career path isn't allowing for family building right now, or um, there's something else, going on in life where this is not the right time for pregnancy, but they know that they want to keep that door open in the future. Sometimes patients are diagnosed with cancer and we're meeting with them much more urgently, and so I see, patients in terms of fertility preservation for both egg and embryo freezing, every day. And then I also see patients who have been trying for 6 months or a year or 5 years sometimes to build their family. And so the day itself involves, seeing consults, doing lots of ultrasounds, sometimes going back into the OR. Each day I have one day where I'm exclusively kind of in the OR and then seeing all the patients, for morning monitoring, where patients who are actually going through IVF and IUIs and other fertility procedures come in and have these visits pretty frequently, in the morning. So we can see a lot of patients, or it might be more of a consult day, where I'm sitting in my office and meeting with couples or individuals and kind of working through what the next steps are.
Right. So it's a lot of planning at different stages of
Lots
their
of discussions.
lives.
Yep.
So when you're not in the office, how do you spend your free time? I mean, I'm sure it takes a mental toll and an emotional toll just being a physician, working with the population that you are. How do you manage, your day to day, your free time, your mental health?
Yeah, sure. Well, I'm fortunate to have a very supportive family. So my husband and my two children, I spend a lot of time with, which is great. Lots of good friends. And I feel like, I mean, I laugh when you say free time, but I feel like most of my time is spent carpooling and, but yeah, no, I mean, I think that work-life balance is really important. And I think that I'm very fortunate at Northwell that I work in such a supportive, environment where most of my partners, are married with families. And I think that, we all kind of support each other also, which helps.
Yeah, I do. It's hard. We're in a different world where moms are working, and
Yep.
it takes a village.
Yep. 100%.
And what other passions do you have outside of medicine?
So, I mean, besides spending time with my family, which is probably my number one. I really like, we like my husband and I like going to Broadway in the city. We really like theater.
I'm sure
And
you miss that part of life when you were in your medical school days and
yes, we actually used to live across the street from all the theaters right in Midtown. And so we would go and get, those same day tickets, which was always fun.
discounted.
Yeah. But no, I mean, really just, I think catching up with friends, I try to stay active. I've started doing Pilates recently. I have also started reading, which I really like. And kind
Okay.
of, I feel like, is good for every mental health and just, nice.
All right. So now we are going to get to our rapid fire part of
Oh,
our segment. And
sure.
this is just like you want to answer the first thing that comes to mind. There is no right answer, just for us to, as the viewers, get to know the other side of
Sure.
your non-clinical side. So, what is a skill that you wish you had?
Ooh, a skill that I wish I had. I've always wished that I could crochet.
Okay.
I know that's a funny one,
It's
but I think
beautiful.
that
It's very therapeutic, I think.
yes. And I think that you can make beautiful things. And I think that it's just one of those things that I never learned and I always wished I did.
Okay, love. I hope you find some time to be able to pick on that skill soon.
Yeah.
What is your go-to comfort food?
Oh, Greek salad, which sounds crazy, but that is my number one favorite food always.
Okay. Would you say coffee or tea in the morning?
Tea,
Tea. Okay.
green tea,
And chocolate or vanilla?
chocolate, all the way.
Okay. And mountains or beachside?
Beach,
Okay, yeah,
always
we need a
beach.
little more warmth here in New York. Well, this was really fun, Dr. Zimmerman. Thank you so much. It's always nice to see the other side of our women's health experts, what's happening in their lives personally. And really, we thank you so much for being a part of this conversation.
Thanks for
And
having
for
me.
those of you viewers, we hope to see you soon.